Hello, my name is Scott Yip, and then we're gonna go through the cranial nerves today. This is my patient. First cranial nerve is cranial nerve 1. It's the olfactory nerve. So this is the sense of smell. I'm going to have her close her eyes and then close one of her nostrils. I'm then gonna add a simple sense that she should be able to pick up on. If her cranial nerve is working properly, she'll be able to identify the smell. And I'm going to use two different smells for two different nostrils. So let's begin. Can you close your eyes and close one of your nostrils? What's the smell?
Cinnamon.
Yes. Now can you close the one that I just tested?
Coffee.
Yep. Good job. So things that can affect this sense are rhinitis, smoking, and aging. For cranial nerve 2, that is the optic nerve. It is a sensory nerve. So this is testing her visual fields and acuity. We usually use an eye chart that is 20 feet away from her, but we're going to use a handheld on my phone right here. So I'm going to have her cover one of her eyes, and I'm going to hold it about 14 inches from the patient's face. Can I have you cover one of your eyes, please? And then can you, I'll have you do this line, read it right to left.
Which one?
The fifth one down.
Okay. D, F, C, E, P.
Good job. And now cover your other eye. And then we'll do the same line, but do it left to right.
P, E, C, F, D.
Good job. So she got it correct. So that was the Snellen eye chart test. And now we're going to do the confrontation. So I'm going to stand behind her and have her cover one of her eyes. And then I'm going to wiggle one of my fingers in all four quadrants. And she's going to tell me if she sees my finger wiggle. And this is to test her periphery. So I'm stand behind her. Can you cover one of your eyes?
Now. 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 Now.
Good. Can you cover the other eye for me?
Now.
Good.
Now.
Good.
Now.
Good.
Now.
Good. So now we're going to do the accommodation test. This challenges the eye's ability to focus from distant to near and vice versa. So now I'm going to sit right in front of her. I'm going to have a pen, and I'm going to hold it about 1 foot away from the patient's face, and then I'm going to ask her to follow the pen as it gets closer, and then I'm going to bring it back towards me, and then I'm going to look at her eyes for if she follows the whole time or not. Ready? So cranial nerve 3 is the ocular motor nerve. It's a motor nerve. Um, First, we're gonna test the 4 extraocular muscles. Superior rectus, medial rectus, inferior oblique, as well as levator papillae muscle, and also the constrictor papillae and ciliary muscles. So I'm gonna face the patient, make an H in the air, and then I'm gonna stand about 10 to 24 inches away from her. I'm gonna make sure that she doesn't turn her head and eyes go the full range of motion. And then I'm looking for, is it smooth and bilateral motion, or is it abnormal? So here we go. You ready? Don't move your head, okay? Don't move your head. Good. She looked pretty smooth. So now we're going to do accommodation for cranial nerve 3. I'm going to pull out my chart again, and then she's going to look at a wall, in this case out the window. She's going to have me read me a line, and I'm just going to see if she can do it. I'm going to check for pupil constriction, or if it cannot accommodate. So it's going to be about 8 to 10 inches from her face. So can you look out the window for me? Can you read the second line?
AP.
Have you look out one more time? Read the second line.
FP.
There you go. Read it one more time. Read the third line for me.
I can't see it. TOZ.
Okay. Now read the fourth line for me.
Can't see it. I can't see it.
No?
I can't see it when I'm looking out the window.
Okay. Could you do the second one again?
FP.
Good. So we'll do the consensual light reflex. This is comparing pupil size. It should be equal bilaterally. Is it okay if I shine a light in your eyes?
Mm-hmm.
You ready? Looks good. The consensual light reflex also includes cranial nerve 2. So cranial nerve 4 is the trochlear nerve. It's considered motor. It only controls superior oblique muscle. Facing the patient, I'm going to make an H in the air again. And then I'm going to make sure I'm looking for a full range of motion. And I'm also wanting it to be smooth. And I'm going to hold her chin so that she doesn't move her head. Ready? It's okay if I touch your chin?
Mm-hmm.
Good. Next cranial nerve is the trigeminal nerve. It's sensory and motor. The sensory test is I'm going to use a cotton tip to test the areas of V1, V2, V3. Her eyes will be closed, and then I'm going to ask her what it feels like. Is it the stick or is it the cotton ball tip? So you close your eyes for me. So this is V3. What does it feel like?
Cotton swab.
Good. This is V1.
Cotton swab.
Good. This is V2.
The stick.
Good. So now we're going to test the muscles of mastication. Do you have any T&J issues, pain when you're eating, or any crunching when you're talking or eating?
No.
Good. So first we'll check the masseter. Can you relax your jaw? And can you bite down for me? Good. Relax. And then we'll test the temporalis. Bite. Good. Now we'll test the pterygoid. Bite down. Good. So now we're gonna have her move her jaw from side to side, and I'm gonna provide a little bit of resistance. I'm gonna look for jaw deviation as the patient opens her mouth. So we'll go to your right. Good. Go to your left. Good. Go to your right. Good. Go to your left. Good. Next we'll do the oculocardiac reflex. This is cranial nerve 5, but it's also cranial nerve 10. First I'm gonna take her pulse to see what it is. We use 3 fingers on her radial pulse. I'm gonna find it, count it for 30 seconds, and I'll multiply it by 2 to get her pulse. And then we'll do the reflex, and then we'll see if it slows down or not. Okay, I found her pulse. So I got 32. That means her pulse is 64. So now I'm gonna have her close her eyes, and then we'll do the reflex. I'm gonna gently press on her eyes. Let me know if it's hurting you. We'll go. So I had her at 26. So her heart rate would be 52. Sorry about that. Just had a brain fart. We'll do the jaw jerk reflex. So this time I'm looking for a maxillary reflex. She's gonna relax her jaw. I'm gonna push or tap downward on the jaw. I'm looking for the muscles to reflexively contract. So you relax your jaw. Yep. So that's it for cranial nerve 5. Cranial nerve 6 is abducens. This is the motor muscle. This is lateral rectus muscle, which moves the eye laterally. So I'm going to use a pen. So look at it straight, and you're going to follow it, okay? Looks smooth. So cranial nerve 7 is the facial nerve. It's motor and sensory. It's all facial muscles except for levator palpebrae. I'm gonna have her make 5 faces for me. So, can you puff your cheeks out? Good. Can you pout? Good. Can you squeeze eyes closed? Good. Can you pucker her lips? Good. Can you smile? Or happy, I guess. Happy? Good. So next is the lacrimal gland test. Do you suffer for unilateral dry eye? So are any of your eyes dry?
Nope.
No? Good. Next is salivation glands. Do you have dry mouth?
No.
No? Good. Taste, do you have any weird taste sensation in your mouth? This is for her anterior 2/3 of the tongue.
No.
No? Good. So the next one is cranial nerve 8. I was told we're not supposed to do cranial nerve 8, so I'm going to go on to cranial nerve 9. Cranial nerve 9 is a glossopharyngeal nerve. It's sensory and motor. The first test is taste the posterior 1/3 of the tongue. So again, do you have any weird taste sensations when you're eating or drinking?
No.
Okay. The next one is the gag reflex. It is the sensory part of the tongue. So I'm going to take a popsicle stick and I'm going to work the popsicle stick to the back of her tongue until she gags. If you have any unusual pain or decreased sensation, can you please let me know? When she gags, I'm going to draw the popsicle stick back from outside her mouth. So can you open your mouth for me? Ready? Good. started gagging. But. So now I'm gonna watch her swallow. This is for the staphylophryngis muscles. If she has trouble, it could be a lesion to the cranial nerve or a carcinoma. So can you swallow for me? One more time. Good. Cranial nerve 10 is the vagus nerve. It's sensory and motor. This is the ah test. I'm gonna look at the back of her throat with the pin light, and then when she says ah, I'm gonna watch for the uvula and pharyngeal arches to rise. They should rise equally. If not, the low side is the side of a lesion in the cranial nerve. I'm also looking for the position of the oh, it's a different test. So can I have you open your mouth and say ah? Wait, what was it? One more time? Looks good. So position of the uvula. There was a problem with cranial nerve 10, the uvula would deviate to the affected side, unaffected side. Maybe stick out your tongue. Yeah, might be good. Looks good. So now we're going to perform the gag reflex again. I'm going to have her stick out her tongue, and then we're going to go all the way back until she gags. This is also with cranial nerve 9. So stick out your tongue. There you go. Taste, so do you have any weird bitter tastes, alterations of when you eat?
No.
No? Okay, so cranial nerve 11 is a spinal accessory nerve, it's motor. So do you have any neck pain when you're turning your head?
No.
Okay, good. So next will be the sternocleidomastoid test. I'm going to place my hands on the patient's cheek, and I'm going to have her push against my hand, check for strength. Looking for bilateral comparison. If one side is weak, then we might have a problem with the cranial nerve 11. So we'll go right first.
What am I doing?
Rotate your head right, like push against it. Yeah, just push against my hand, sorry. Yeah, just push against my hand. Go right first. Good. Now go left. Good. Go right. Good. Go left. Good. Trapezius test, it's the shoulder shrug test. I'm going to stand behind her, and then I'm going to place my hands at the distal end of her shoulders. We'll have the patient lift her shoulders while I press down, and then I'll tell her to slowly relax her shoulders. I'm checking for bilateral strength, symmetry. So go ahead, shrug. Good. Now relax slowly. Good. Cranial nerve 12 is hypoglossal nerve. It's a motor nerve. I'm gonna have her stick out her tongue again. I'm gonna look to the sides and the top. I'm looking for fasciculations. So stick out your tongue. Okay, you open your mouth too. She looks good. I'm also gonna look for tongue deviation, and if it deviates, it goes to the side of the lesion for cranial nerve 12. So stick out your tongue. Doesn't look like it's deviating. Now we're gonna check the muscle strength of her tongue. I'm gonna put my hands on her cheeks. I'm gonna have her push away the hand with the tongue. I'm looking for bilateral comparison. If there's weakness, there might be a contralateral lesion. Go. Right first. Good. Left. Good. Right. Good. Left. Good. Thank you.